If I have to go to a healthcare facility, how can I best protect myself?
Well, it's a really good question, and I'm glad you asked it. So it's really important before you go that you're equipped. In your pocketbook, you want to make sure that you have gloves. If you can if you have a mask available to you, hand sanitizer. You have tissues or towels that you can use for, like, let's say, opening doorways. And then you could drive yourself to where you're going or get driven. And my recommendation to you is to wear gloves, rubber gloves if you have them. And I also do recommend wearing a mask for three reasons. A mask primarily protects you from you so that you do not touch your face. That's important. Number two, a mask protects you from other people so that you don't, to reduce the risk of catching anything from somebody else. And a mask protects other people from you. So that is important. So a mask covers your nose and your mouth. It's good to wear glasses like I am here, because that protects any droplets from getting into your eyes, which is one method of transmission. If you don't have glasses, see if you have safety glasses at home, or find a pair of glasses that you can wear to protect you from getting anything into your eyes. And now you're ready to go, okay? So I would say that while you're getting chemotherapy and you're sitting in the chemotherapy chair, before you get in there, I would wipe down the chair with a disinfectant, or ask them if the staff, if they just did that. And when I'm sitting there in the chair for a few hours, I would make sure that you have gloves on so that you're not touching the armrests of that chair during the time you're in the chair. And then, try to go through your treatment and at a distance from somebody else, like to be at least 6 feet away from the next person who's affected, and to make sure that the nurses who are giving the chemotherapy are also wearing masks. And you can request that if they get close to you, because they are going to be close to you, hooking up the IVs and calibrating the pumps and all of that. I would apply the same principles if you're going for radiation therapy. When you come into the department, you're opening up door handles, and you are sitting in chairs waiting. Those armrests, you don't assume those armrests have been cleaned off before you sit down. And as soon as you are ready to go to the bathroom, take off your gloves, wash your hands, and don't touch your face. As soon as you finish getting your treatment and you leave the building, I would wear your gloves until you reach the car. Then I would take off your gloves and then enter your car as your safe, clean place that it usually is. And when you get home, wash your hands. Wash your hands as soon as you get home. Another thing I recommend is that you have one pair of shoes that you wear outside the house, so that you have a pair of shoes that you're going to wear outside to the hospital. And as soon as you come in the house, take them off and put them right next to the door, and have a pair of slippers that you can wear around the house, or another pair of shoes. Those are just some practical examples.